Sexuality education in schools promotes abstinence before marriage and teaches facts about contraceptions, consequences of casual sex, prevention of diseases, and how to say no to sexual advances. It also helps to reduce the incidence of sexual transmitted disease or teenage pregnancies. The United Nations Population Fund, in collaboration with the Ministry of Basic and Secondary Education, has on Tuesday commenced a two-day national consultation. The consultation is centered on quality health, comprehensive sexual education, and empowerment of women, youth, and adolescent girls. Speaking at the opening, the UNFPA country representative Ndeiro Sar says to reach the Sustainable Development Goals and to realize the fulfillment of young people's potential, there is a need to an accelerated approach to build a safer world for women and girls.
To reach the Sustainable Development Goals and to realize the fulfillment of young people's potential, there is a need for an accelerated approach to build a safer world for women and girls, especially adolescents. Gender equality goes hand in hand with access to rights and choices and bodily autonomy. Comprehensive sexuality education is also a stepping stone to achieving the three transformative results UNFPA believes in, which are zero unmet need for family planning, zero preventable maternal deaths, and zero gender-based violence, including harmful practices. The 2 days national consultation we are about to begin and the launch on the third day of the Education Plus will strengthen our collective resolve for healthy and empowered adolescents in the Gambia and will lead us to the launch of the Education Plus initiative on July 7th.
The UNFPA representative explains the key components of the Education Plus initiative.
The Gambia has made significant progress in closing the gender gap in primary education, with 99% of girls finishing primary school as compared to 90.4% for boys. However, only 48.2% of girls go on to complete secondary school. At the main university in the Gambia, 42% of potential 22 graduates were female compared to 58% of males. 1 in 5 young women aged 15 to 19 years, which is the equivalent of 19%, are currently in a union, compared with less than 1% when it comes to their male counterpart. Early marriage impedes adolescent girls and young women's potential to grow to their fullest potential. We should also know that there is a limited access to reproductive health information and services and user-friendly health services contributing to teenage pregnancy, with twice as many girls aged 15 to 19 getting pregnant in rural areas than in urban areas.
She says the Gambia has made a significant progress in primary education.
The key components of the Education Plus initiative's approach include essential elements of what every adolescent girl and young people should be entitled to in transitioning to adulthood: completion of a quality secondary education, universal access to comprehensive education and information, fulfillment of sexual and reproductive health and rights, including a life free of HIV and AIDS, freedom from gender-based violence and sexual violence, school-to-work transitions, and economic security and empowerment.
On behalf of the Ministry of Basic and Secondary Education, the Deputy Permanent Secretary Administration at MOPSI, Laumi Williams, says adolescent girls are among the most vulnerable groups and must always be protected.
Through national programs such as sexual and reproductive health education, family life and HIV education, or integrated sexuality education, countries in the West and Central African region aim to provide adolescents and young people with the knowledge, attitudes, skills, and services that will enhance their health, well-being, and empowerment. Education on comprehensive sexual comprehensive sexual education has been identified as a key priority area in empowering adolescent girls to make informed choices and reaching their full potential in school and their lives in totality. Adolescent girls are amongst the most vulnerable groups and must always be protected.
In January 2015, African leaders expressed in the Agenda 2063 an aspiration to people-driven development, relying on the potential of African people, especially its women and youth, and caring for children. The agenda hinges on sustained investments in education and the elimination of gender disparities at all levels. In view of this, countries in West and Central African region express the need for a high-level regional commitment to ensure that all adolescents and young people have access to education and health services, to respond to early and unwanted pregnancies, HIV and gender-based violence, and for provision of sexual and reproductive health services tailored to their needs. Reporting for Kerr, Fatou, I am Buba Gajigo.